Do you ever feel short of breath, even when you're not doing anything strenuous? Do you have a dry cough that won't go away? Do you feel tired and weak all the time? If you answered yes to any of these questions, you might have a condition called interstitial lung disease. Interstitial lung disease is a group of disorders that cause scarring and damage to your lung tissue, making it hard for you to breathe and get enough oxygen. Interstitial lung disease can affect anyone, but it is more common in older adults, smokers, and people who have certain occupations or hobbies. Interstitial lung disease can have a significant impact on your quality of life and your life expectancy, so it is important to get an early and accurate diagnosis and follow your doctor's recommendations. In this video, I'm going to explain what are the symptoms of interstitial lung disease, how they can vary depending on the type and severity of the condition, and what you can do to manage them. If you want to learn more about this serious and complex condition, stay tuned and don't forget to subscribe to my channel for more health-related videos. Hi, everyone. Welcome to Fit Life Junction. Today I'm going to talk about interstitial lung disease symptoms. Interstitial lung disease is not a single disease, but a term that covers more than 200 different types of lung disorders that share some common features. They all involve inflammation, scarring, or fibrosis of the lung tissue, which makes it harder for oxygen to pass from the lungs into the bloodstream. This can lead to shortness of breath, coughing, fatigue, weight loss, and other symptoms. Interstitial lung disease can be caused by many different factors, such as exposure to harmful substances, infections, autoimmune diseases, medications, or genetic mutations. Some types of interstitial lung disease are reversible and can be treated with medications, while others are progressive and may require lung transplantation. In this video, I will give you an overview of the main symptoms of interstitial lung disease, how they can differ depending on the type and cause of interstitial lung disease, and how they can affect your daily life. Let's get started. What are the main symptoms of interstitial lung disease? The primary symptoms of ILD are shortness of breath that gets worse with exercise or exertion. This is the most common and noticeable symptom of interstitial lung disease, and it can affect your ability to perform simple tasks, such as walking, climbing stairs, or dressing. Shortness of breath can also cause anxiety, panic attacks, or depression, as you may feel like you are suffocating or drowning. Shortness of breath can be mild or severe, depending on the extent of lung damage and your level of fitness. Dry cough that doesn't produce any mucus or phlegm. This is another common symptom of ILD, and it can be irritating, painful, or disruptive. Dry cough can also interfere with your sleep, causing insomnia or daytime fatigue. Dry cough can be persistent or intermittent, depending on the type and cause of ILD. Fatigue or weakness that doesn't improve with rest. This is a less specific symptom of ILD, but it can be a sign of low oxygen levels in your blood, or a result of chronic inflammation or infection. Fatigue can affect your mood, concentration, memory, and motivation, making it hard for you to work, study, or enjoy your hobbies. Fatigue can also increase your risk of falls, injuries, or accidents, as you may have less balance, coordination, or reaction time. Chest discomfort or pain that may be sharp, dull, or achy. This is a rare symptom of ILD, but it can be a sign of inflammation, infection, or fluid buildup in your lungs or around your heart. Chest pain can also be a sign of a more serious condition, such as a heart attack or a pulmonary embolism, which is a blood clot in your lungs. Chest pain can be constant or come and go, depending on the type and cause of ILD. Clubbing of your fingers or toes, which means that the tips of your digits become enlarged, rounded, or swollen. This is a late symptom of ILD, and it indicates that your blood oxygen levels have been low for a long time. Clubbing can also affect your nails, making them curved, thick, or brittle. Clubbing can also be a sign of other conditions, such as heart disease, liver disease, or thyroid disease. How do the symptoms of ILD vary depending on the type and cause of ILD? As mentioned earlier, ILD can be caused by many different factors, such as exposure to harmful substances, infections, autoimmune diseases, medications, or genetic mutations. Depending on the type and cause of ILD, the symptoms may vary in onset, duration, severity, and progression. For example, exposure to harmful substances, such as asbestos, silica, coal dust, or bird droppings, can cause ILD that may take years or decades to develop, and may worsen with continued exposure. The symptoms may include cough, shortness of breath, chest pain, and weight loss. Some types of ILD caused by exposure to harmful substances are asbestosis, silicosis, coal workers pneumoconiosis, and hypersensitivity pneumonitis. Infections, such as tuberculosis, pneumonia, fungal infections, or viral infections, can cause ILD that may develop quickly or slowly, and may improve with treatment or become chronic. The symptoms may include fever, night sweats, blood in the sputum, and enlarged lymph nodes. Some types of ILD caused by infections are tuberculosis, pneumonia, fungal pneumonias, and viral pneumonias. Autoimmune diseases, such as rheumatoid arthritis, lupus, scleroderma, or Sjogren's syndrome, can cause ILD that may develop gradually or suddenly, and may flare up or go into remission. The symptoms may include joint pain, skin rashes, dry eyes, and dry mouth. Some types of ILD caused by autoimmune diseases are rheumatoid arthritis-associated ILD, lupus-associated ILD, scleroderma-associated ILD, and Sjogren's syndrome-associated ILD. Medications, such as chemotherapy drugs, antibiotics, antiarrhythmics, or anti-inflammatory drugs, can cause ILD that may develop within days, weeks, or months of starting or stopping the drug, and may improve with discontinuation or become permanent. The symptoms may include rash, eosinophilia, or liver dysfunction. Some types of ILD caused by medications are drug-induced ILD, drug-induced pulmonary fibrosis, and drug-induced hypersensitivity pneumonitis. Genetic mutations, such as those affecting the surfactant proteins or the telomeres, can cause ILD that may develop early or late in life, and may be inherited or sporadic. The symptoms may include growth failure, recurrent infections, or premature aging. Some types of ILD caused by genetic mutations are surfactant protein deficiency, telomere-related ILD, and familial pulmonary fibrosis. How do the symptoms of ILD affect your daily life? The symptoms of ILD can have a significant impact on your daily life, affecting your physical, mental, and social well-being. Some of the ways that ILD can affect your daily life are: physical. ILD can limit your ability to perform physical activities, such as walking, climbing stairs, or carrying groceries. You may need to use oxygen therapy, inhalers, or nebulizers to help you breathe better. You may also experience side effects from the medications you take, such as weight gain, mood swings, or infections. You may need to undergo regular tests, such as blood tests, lung function tests, or imaging studies, to monitor your condition and adjust your treatment. You may also need to consider lung transplantation, which is a major surgery that involves risks and complications. Mental. ILD can affect your mood, causing anxiety, depression, or anger. You may feel scared, hopeless, or frustrated about your condition and your future. You may also have trouble sleeping, concentrating, or remembering things. You may need to seek professional help, such as counseling, therapy, or medication, to cope with your emotions and stress. You may also benefit from joining a support group, where you can share your experiences and feelings with others who have ILD. Social. ILD can affect your relationships, causing isolation, loneliness, or conflict. You may feel embarrassed, ashamed, or guilty about your condition and your limitations. You may also feel misunderstood, judged, or rejected by others who don't understand your condition or your needs. You may need to communicate openly and honestly with your family, friends, and co-workers, and ask for their support and help. You may also need to educate them about your condition and how they can help you. You may also need to find new ways to enjoy your hobbies and interests, such as online classes, books, or podcasts. ILD is a group of disorders that cause scarring and damage to your lung tissue, making it hard for you to breathe and get enough oxygen. ILD can cause symptoms such as shortness of breath, dry cough, fatigue, chest pain, and clubbing of your fingers or toes. The symptoms can vary depending on the type and cause of ILD, and they can affect your daily life in many ways. The treatment of ILD depends on the type and cause of ILD, and it may include medications, oxygen therapy, pulmonary rehabilitation, or lung transplantation. The goal of the treatment is to reduce the inflammation and scarring, improve the lung function and oxygen levels, relieve the symptoms, and prevent or slow down the progression of the disease. The treatment of ILD can also have side effects, risks, and complications, so it is important to follow your doctor's instructions and report any changes or concerns. The treatment of ILD can also be costly, so you may need to seek financial assistance or insurance coverage. ILD is a serious and complex condition that can affect your physical, mental, and social well-being. However, there are some things that you can do to prevent it or cope with it if you have it. Some of the tips that can help you are: Avoid or reduce your exposure to harmful substances, such as dust, mold, animal dander, or chemicals that can irritate or damage your lungs. You can do this by wearing protective gear, such as masks, gloves, or goggles, when you work or play with these substances, or by keeping your home and workplace clean and well ventilated. Quit smoking or avoid secondhand smoke, as smoking can worsen your lung damage and increase your risk of infections and complications. You can seek help from your doctor, a counselor, or a support group to help you quit smoking or stay smoke-free. Eat a healthy and balanced diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, that can provide you with the nutrients and energy you need to fight inflammation and infection, and to maintain your weight and muscle mass. You can also drink plenty of water to keep yourself hydrated and to thin out your mucus. Exercise regularly, as exercise can improve your lung function, oxygen levels, blood circulation, and mood. You can do low-impact activities, such as walking, swimming, cycling, or yoga, that are suitable for your fitness level and your lung condition. You can also consult your doctor or a physical therapist to design an exercise program that is safe and effective for you. Manage your stress, as stress can worsen your symptoms and affect your mental health. You can practice relaxation techniques, such as deep breathing, meditation, or mindfulness, that can help you calm your mind and body. You can also do activities that you enjoy, such as reading, listening to music, or gardening, that can help you relax and distract you from your worries. Seek support, as living with ILD can be challenging and lonely. You can reach out to your family, friends, and co-workers, and ask for their help and understanding. You can also join a support group, where you can meet other people who have ILD and share your experiences and feelings. You can also seek professional help, such as counseling, therapy, or medication, if you feel overwhelmed, depressed, or anxious. Thank you for watching this video. I hope you learned something new and useful about interstitial lung disease symptoms. If you liked this video, please give it a thumbs up and leave a comment below. I'd love to hear from you. And if you're new here, make sure to hit the subscribe button and the bell icon to get notified whenever I post a new video. And if you want to learn more about interstitial lung disease, check out my other videos on this topic. I'll see you in the next video.